Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-Hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Hello Gandhi, how are you today?
I'm not too bad, how are we doing?
I'm very well. I heard that there's mumps in your area. What's happening?
Yeah, so it's actually a breaking news story. It came out last night that there's been a mumps outbreak in Nottingham across the university patches. So actually before we were speaking, I was just speaking to the radio team and stuff about, the medical perspective and that kind of thing. And obviously how mumps is a viral condition, manageable, but obviously something that we need to know about because it spreads so rapidly and things, and just trying to get across the message about vaccinations as well, because it's obviously a key part of it.
And I mean, for me, these sort of issue of immunization, vaccination, there's a lot of conflicting theories and conflicting stories. Some experts, i.e. doctors, say, no, don't touch vaccination. The majority of doctors say, please vaccinate. And obviously that's causing a decrease in uptake of vaccination within the general population, which is causing the outbreak. Yeah. Why do we have these sort of rogue people saying, conflicting issues, which goes against scientific knowledge, and they're trained doctors, they've sort of been through the whole system. Why is this sort of rogue elements of thought processes? Yeah,
I mean, I guess there's a variety of different reasons for that happening. One is that evidence changes all the time for a start. So if you go back several years, there were drugs that we used to use that used to be this is the best way to treat condition A. And then 20 years later, we find out the actual impact of those kind of drugs. And that's something that only time gives us. I'm afraid, that's not something you will find out from day one, from day 10, from year 1, year 10. It takes time for that to happen. So there is some element of that. I think in terms of the concept of vaccinations, be absolutely clear, vaccinations protect the population. That's what they're designed to do. Yes, they definitely protect the individual, but it's also to try and protect the population, because the more people you protect, the less likely it is you'll have outbreaks and that kind of thing. So therefore, it's about protecting your community just as much as it is for yourself. In terms of why some clinicians will focus on one particular message, that could be down to their own beliefs and, the message they're trying to push. And I guess in particular, when it came to the MMR vaccine, one important thing to remember is that the key kind of research that focused on that link between the MMR vaccine and autism, which was the reason why a lot of people kind of said, I'm not touching them, was proven to be debunked. That was something that was looked at numerous times and time again. It's been an isolated study, and actually there was a lot of questions raised about the protocols and the process of that study that showed that actually it's not something that's been repeatable. Effectively, I mean, you could also use the term fake news if you wanted to. It depends on your perspective and that kind of thing. But unfortunately, the implications of that study is now the consequences we're dealing with today. So we now have a generation that have not been vaccinated against measles, mumps, rubella. And like I said, we're now seeing an outbreak of mumps across Nottingham. I think it's something like 40 confirmed cases, 250 odd suspected ones. And the problem with a condition like mumps as well, because of the lead time that it has, it spreads like wildfire, because you may actually carry the virus and not get any symptoms for up to 2 to 3 weeks later. And therefore, you've probably passed it on to several people in that time frame without even realizing it. And that's the concern. So unfortunately, it's one of those things that if you had a time machine, go back and fix and all will be right in the world. You don't. So the reality is, get advice and make sure that you're following current trends, really.
Yeah. I mean, it's difficult when, we're told to listen to authority, and yet at the same time, we're encouraged to question authority.
Yeah.
And, we see that on a daily basis when we're seeing our patients. I mean, we want our patients to question us, because it allows us to sort of improve our evidence and improve our way of thinking as well. Is there a balance here? I mean, can we find the right balance, or is it just life? That's just the way it is.
I think there's always going to be perspectives that people have, and some people will hear and listen to one message louder than what some people hear and listen to another message. I think the key thing is look at information that is validated, look at information that is trusted. Don't just go off, oh, my neighbour's cousin's ex-wife said this kind of thing, and this happened, because that's a story, that's an individual circumstance that may or may not be true, particularly when it goes second hand, third hand, fifth hand. How accurate can that information be? Whereas if you go to validated, trusted resources, those kind of things, you will get clear cut. This is the pros, this is the cons. You make the conscious decision that you feel is best for yourself. And actually, if you look at that accurate information, you're able to make the best informed decision. If you go off hearsay, okay, you're trusting, your health, your life, your family's life, to hearsay. Is that sensible? Is that healthy?
I think time is really important here. I mean, the issue of time, the issue of experience, how much time have we looked at in this issue? What is the experience of this individual who's explaining these different theories and ways of thinking? But people don't have time now these days.
No, unfortunately, modern life is busy, 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 and everybody wants everything here now and 10 minutes ago kind of thing. And that's a challenge that people have in modern society. And the reality is sometimes you just need to stop. You just need to think, and you just need to take a little bit of time to look after yourself, to look at the reality in front of you and deal with that, rather than just moving on and on and on to the next thing. And you're right, that's maybe why so many people struggle at the moment, because there is such a busyness in terms of how we live, how we work, our lives and things. And that probably needs changing. That perspective needs changing.
I mean, it definitely needs changing for doctors, in terms of training, in terms of their workload, in terms of their work careers and their pathways, and just life in general. If we gave them, rather than having a time frame, but just say, look, this is the resources, take your time, rather than having to rush through everything.
Exactly.
Being a GP in 3 years, you learn GPing on the job with years and years and years experience. 30 years down the line, you're much better as a GP than, sort of going into it, having passed your exams. Me as an ophthalmologist, I've been an ophthalmologist for 20 years now. I compare myself now to when I just started my training, or 5 years into my training. It's just, you can't compare. You just can't compare the two.
I agree.
And that sort of concept of time is so important. So if you do have an authority who's supposedly saying all these things, you've got to sit down and look at the time frame.
Definitely. You talk about general practice training and that kind of thing. So you're right. At the moment, GP training, after you qualify, you do 2 years of your foundation, and then you do 3 years of GP training. And it is an absolutely recognised fact across the profession that 3 years to compile the entire of medicine into is just ludicrous. And there is this view that very much that GPs that come out at the end of the 3 years are competent because they've been assessed by the criteria and stuff, and they have the skills to manage patient care and that kind of stuff. But do they have the confidence? That's the question. So a lot of the things, like you said, come with experience. It's the exposure, it's the time to see those kind of things that you see as normality. Because actually, about 80% of the work I do is telling people that what you have is normal. It's about recognizing the difference between what is a normal variant, or what is actually genuine pathology, what is something that we need to be more concerned about, we need to look at in more detail and that kind of thing. And that comes with experience as well as with training. And definitely there is a move towards having a longer GP training time, because it is the most widest profession in medicine. The only specialty that comes anywhere close is A&E, and A&E still focused obviously on the immediate aspect of health and that kind of thing. And actually, it's one of the areas where we need the most clinicians right now. We have a massive shortage of GPs. We were meant to have 5,000 GPs by next year, and actually compared to where we were, we're about 300 less. So we're losing GPs, we're hemorrhaging them left, right, and centre. So having decent training, I think, is part and parcel of it. There are definitely other aspects, like you mentioned, in terms of the way that we work in the NHS that need to change. And I'll give you an example, actually. So I'm a GP trainer. Part of my role is to train new GPs, and I've been doing that now for about 5 years or so. And I had a colleague recently, who said to me, you know what, I'm feeling a little bit unwell. I'm not sure, what I should be doing. And, I asked him, okay, explain to me what's going on. And he was like, well, I was just lying on the floor a few minutes ago. I was in that much pain from my stomach. And I was just like, why are you still here? He was actually asking me, should I continue working? That was his question to me. And I simply said, look, you need to look after yourself. The job is busy and it's important. And obviously people's health and all that kind of stuff is at risk and things. But actually, if you're not able to do the job because you're not well, how is that looking after other people? And I completely get it. Many people often feel that if I'm not there, then the system will get worse or other people will have more pressure. And that's one of the reasons why, the altruistic aspect of doctors is often overused, and you could even say abused, to try and make sure that the service keeps running. But I'll be quite clear on this point. It's a message I say to a lot of my colleagues, to my peers, all that kind of stuff. If you yourself are not well, how can you ever expect to look after somebody else? We say that to our patients. How often do we see our patients who are struggling, who are genuinely challenged by what's going on in their life, with their health, that kind of stuff, and they're looking after other people? They could be the mum, the daughter, the brother, the father, that kind of stuff. But they themselves are not well, and they're meant to be looking after somebody else. And yes, that's important. That may need to still happen. But also the importance is looking after themselves as well as that other person, because otherwise they're not going to be able to do it. And we don't have that clear message often in the healthcare system at the moment, in the NHS. It is very much look after the patient, look after the system, look after the hospital, the practice, that kind of stuff. We need to look after ourselves just as much as that, if not more so. Yeah, sorry, I waffled a bit there, didn't I?
No, you didn't waffle. It's just so important. And okay, there's sound bites and there's rhetoric and there's, whatever you want to call it, political spin. But we want actual actionable things on the ground, literally. We're talking about time here, time off work, self-directed, self-help, self-loving sessions where you go off and just have a great time and just sort of spend time on yourself. We literally have to force that onto doctors sometimes because they just don't do it because that's the culture.
True. I mean, it's the message I give to some of my patients. I sometimes turn around to them and say, I want you to be selfish. I want you to look after yourself rather than looking after other people right now, because that's the most important thing. And that's the same message we sometimes need to give to our colleagues. Our colleagues that are working.
Sometimes we have to.
Yeah.
We have to force it on them because they just don't do it.
Definitely.
And, once they do it, they think, wow, this is actually helping me so much. I need to do more of this. So when they come back to work, they're just so buzzing, and they're just
exactly.
They're just amazing, even better doctors, performing even better, and that maxim, the less you do, the better you get, kind of thing. It's all about doing less, not more.
Yeah, I mean, where is the benefit of you working 12, 14 hours a day, 5-6 days a week? How long can you honestly maintain and sustain that? You may, people are your listeners out there may be young individuals who think, I can do this. Yeah. Can you really do that for 20, 30 years? No, it's not going to happen. You will burn out. It's a guarantee, and one of the things that we're seeing across general practice right now is that if you go back 10 years ago, working 9-10 clinical sessions was the norm. Yeah. Okay. That was the absolute norm across the patch. There were many doctors that used to do that. The complexity, the bureaucracy, the challenges that we now face in healthcare in terms of the intensity of that workload that we have to deal with mean that I would argue any doctor currently doing 9-10 clinical sessions will burn out with absolute guarantee. That doesn't mean to say that it can't do other things, but just doing 9-10 pure clinical sessions, I can guarantee you burnout is knocking on your door at some point, because it is just so hard to do that work on a day in, day out basis. And there needs to be that aspect of looking after yourself. So I myself, I used to work 7 clinical sessions in my practice, and I realized that actually I was not coping. There were other things I wanted to do, other things I needed to do, and trying to fit that all in was a real challenge. And so I had to go to my partners and I had to say, look, I need to still work. I want to still work here. This is, my priority more than anything else in terms of my working life. But I know I can't do what I'm doing right now. I may be young, I'm still under 40, You
look about 24, mate.
Wow. Okay. Thank you. I'm going to have to tell that to my wife. I don't think she'll believe you. But effectively, I know I can't do that for the rest of my career because it's just going to kill me. And it was, I was getting tired. I was getting grumpy. I was getting short with people. I saw those signs of burnout starting to happen. So I went to them and I said, I need to cut back. I know that's going to have an impact on the practice. I know that means it's going to be more difficult.
But you come first.
That's like I said, if you don't look after yourself, you can't look after others. And actually, since doing that, yes, it's put a bit more pressure on the practice. But actually, we've managed that pressure. And, we're looking at ways. That's also giving me the headspace to then look at ways that we can actually change things better. Because now I've got a bit more free time, a bit more spare time to focus on those challenges I've been facing and actually work out how we can manage things more effectively, more safely in the practice as well. So we're seeing some of the benefits, hopefully, of that now, and we will continue to do so.
Now, given that you like mythology, if you did have a time machine, where would you go back to, and what would you do?
Oh, that's an interesting question. I'd probably go back to university, because and say to myself, the academics important, all the things that you're doing is really important, but also remember to look at yourself, focus on what's important to you and learn to say no a bit better. I think that's a challenge, especially in the medical profession and especially in those individuals that do like to perform well, that we often say yes to everything and anything that comes our way because we think that opportunity may not come across or that sounds too enticing or appealing for me to miss. So you say yes, and then next thing you know, you're doing 100 things instead of 10, And again, how long can you maintain and sustain that? So, saying to myself, look at what you're doing, learn to say no sometimes. And I'd probably say to myself, also go off and invest in Google and Apple. That's probably a sensible thing for me to have done back then.
Yeah, fair enough. And you like mythological characters. Who's your favorite and why?
So I'm a massive fan of Lord of the Rings. So my nickname is actually Dr. Gandalf. So hands down, Gandalf is one of the big ones up there. I also love the comics, Marvel, DC. More of a Marvel fan than a DC fan. But yeah, basically
why?
I don't know. Partly it might be to do with the names. So Stan Lee, who recently passed away, unfortunately, the creator of Marvel Comics, along with Steve Ditko, he had this thing where he would always name his characters with the same letter. So Peter Parker, Reed Richards, Bruce Banner. It was always, and that just it was funny to me. It's
cool,
unique.
Isn't it? Yeah.
Yeah. But I think there's also that DC is a little bit more darker, I'd say, in terms of the message. So, the Batman, Superman, those stories are a little bit more darker and more unique in the way they come across. They're still great things. The Batman comics are amazing and things. And some of the lesser known stories are really good. I'm quite into Black Lightning at the moment, which is a lesser known DC character and stuff. Comic books, mythology, more along the lines of Lord of the Rings. But actually, one of my first introduction to mythology was the Greek stories. The Greek gods and that kind of thing. And the heroic tales of Hercules was something that in my head, how could one individual be so powerful they could do all these various amazing things? And it just, to me, was always an inspiration that how could he do this? It was boggling to me at the age of 7 and 8 that this one person could go off and lift a barn, or he could beat a lion or tame a dragon, all those kind of things, and that just was like, wow, that's imagination there. But it wasn't, that's historic cultural tales that have been passed down and time again. And I think there's something magical about that, really, because it helps drive the imagination, it helps drive the soul, in terms of that message it comes across. So yeah, any and all kind of mythology. I'm a bit of a geek when it comes to that, I have to admit.
What got you started? Was it that sort of inspirational message and story?
Yeah.
Or was it someone that introduced you to it?
I think it was the inspirational stories I heard in school in terms of, the mythology side of things. And then from that, it went to the comic books, and, the comic books were great. There were pictures that you could read and that kind of...
Getting away from it, isn't it?
Yeah, imagination, isn't it? It's the escapism of it. It's that concept that somebody can do something above the human capabilities. And if that's possible, then anything's possible.
Well, I mean, you are doing extra human work, I think, with all the patients that you're seeing and all the great work that you're doing and all the different things.
Yeah, I don't know if my patients would always say that, but thank you for that one. Yeah. But, mythology, I think, has the opportunity to give you the escapism. It has the opportunity to give you that way of talking to other people. I love talking to my son about these stories, trying to introduce him to this whole world or universe of what can be. And, right now his favorite is Spider-Man. Everything is Spider-Man. And you know what? That's great. Yeah. He's got this concept of this individual that can do amazing things. And he'll then go off and try and climb something. And obviously I'm there, the anxious parent, just hoping he doesn't fall and break his arm or something like that. But at the same time, that's given him the inspiration to try and do something that I know a few months ago he wouldn't have done because he was too scared. And it gives him.
Can we give that to patients? Can we give that to our GP colleagues?
I think we need to. I think how you speak to each person is obviously that individual message. So, it's the voices they need to hear. And, fair enough, if we go off and tell someone, go off and be Spider-Man, that may not work. But, it's hearing inspirational messages from people that they respect and can understand. So, actually, there's a really good scheme that does that. So, I don't know if you've heard of a scheme called the Next Gen GP. It's something I've been fortunate to engage with, so I was one of the Nottingham cohorts for it. But it was a scheme started by a doctor called Nishma Manik, who's one of the NHS England clinical fellows. It's been running, I think it's now its second year, if I remember rightly. And it's basically giving young clinicians and young potential leaders the opportunity to hear from those experienced leaders that have done, what we kind of aspire to do. And not necessarily that they're all, established, career-driven people. Some of these people are truly, one of the most impactful ones I've heard was hearing from Dr. Nikki Kanani, who's our current Director of Primary Care at NHS England. So similar age to myself, amazingly accomplished woman. The stuff that she has done is just mind-boggling, and how she does it and the inspiration she gives when she speaks. Another one, unfortunately, I missed, but I'm trying to catch up on a second event, is one of our colleagues who, as a medical student, took over 3 practices, and they're now running more effective than some of their neighbouring practices. And this was as a medical student she did this. I mean, if someone at that stage in their career can then go on to run 3 practices effectively, and now she is currently going through training to be a GP, but she's running 3 general practices effectively. Wow. How can that not be inspirational to what an individual can do if they put their mind to it?
Wow. I mean, this reminds me of the psychiatrist Carl Jung and the whole mythology psyche of the collective unconsciousness, and it's just so vast, and it's just so much wisdom there.
Yeah.
And it sort of brings everything together, both the medicine and the mythology and religion and science. And he truly inspires me as a physician. He's someone that sort of totally takes me into the realms of mythology and the next world, and the concept of possibility and potentiality. Now, talking about potentiality,
sure,
tech and artificial intelligence and healthcare. Yeah. I mean, we've got 2 minutes.
Okay,
what
fine.
Can you tell me in 2 minutes about that massive potentiality?
Wow. Okay. So there's no doubt that tech is going to change the way that healthcare is delivered. It's a key message that's being pushed as part of the contractual changes in general practice, as part of our Secretary of State for Health. Matt Hancock, he's a massive user of tech, to the point he's created his own, a separate organisation to drive digital healthcare. So NHSX, which is going to come into establishment shortly, or already is running. I'm not quite sure. And like you said, there's various different aspects to this. There's, the method of consultations, like video consultations, that kind of stuff, which I spend quite a lot of time talking about. So, I educate people on how to do video consultations and those kind of things. And I actually got some videos about that coming out in the coming weeks on my eGPlearning channel. But actually, the bigger areas are probably things like AI, genomics, that kind of stuff that's coming through. How that will impact healthcare? Well, I think that initially there was a bit of a massive hype train about it, and basically you stick AI onto anything and it automatically became 10 times more valuable, and it was kind of like blockchain, there were some companies that suddenly went out and created a blockchain website of their own established, taco brand kind of thing, and all of a sudden they became 10 times more valuable, and then it crashed because actually people kind of realized that may not be applicable to everything. But I think AI has the potential to be more supportive. I think it can definitely help, and to be honest, in some ways we use AI already. So when I look at results, I've already got clinical systems that help me identify quicker the abnormal versus the normal kind of results and that kind of stuff, and I can scan those more quickly and effectively because of that intelligent software that does that. More machine learning and actual proper AI is just an advancement on that. Is it at a stage where we can say it's completely and utterly safe and able to manage patient healthcare data and triaging and all that kind of stuff, which is one of its main uses at the moment? I'd argue we're probably not there yet. Some people would say differently. Fair enough. They're entitled to that. But I think it's a tool. And this is the key thing people need to remember. It is a tool, and the tool is absolutely useless without the person to wield it. You could have the most amazing, all-encompassing hammer that will guarantee to knock a nail into a wall, but it still needs the force of the wielder to move it. And that's no different when it comes to healthcare and all these technologies. And it still requires the patient, obviously, but also requires the clinician to interpret all that information. Because if you just have the system interpreting it, that's when you get the Google search that says, 90% of what you may say may be cancer. But actually, is it? Where's the humanistic side of that? Where's the the understanding of what people are actually saying? Where's the colloquialisms? All those kind of different aspects that make you realize how to filter that down. That's sometimes negated by tech. It is a definite tool. It's a very useful tool. And tech, I think we will see massively becoming more and more of the healthcare delivery mechanism. But it's important to remember that reliance on the tech itself is not the focus. And I guess the best example I can give you, we are taught time and time again in medicine, the patient is the patient, they're not the result. So how many times will you see an abnormal result? If you just went off that, you'd have an algorithm that you have to follow, a guidance that you have to follow. But it's important to remember that is part of it. The patient is the other part. And you have to match those two things up. Otherwise, you're not going to get appropriate outcome.
And we come back to time. And we come back to healing, and we come back to experience, and we can't get away from that. That we do need that wise Gandalf, with a big beard, and just to say, do you know what? It's fine. It's okay.
I probably see myself more as a games master in that, and I guess one of the other things that I would love to talk about would be gaming effectively. So I'm a massive fan of board games as well as being a comic geek and mythology geek and that kind of stuff.
Can we use board games in medical practice?
I hope so. So I'm trialing it. So a couple of weeks I've actually got a session with some of my colleagues as a social event, and that social event is in a board game cafe. I'm basically convincing my colleagues to come around and play board games. Why? It's a great way to unwind. Great way to engage with people socially, because the majority of board games are social-based activities. Definitely some interesting learning skills and that kind of stuff, and obviously enjoyment that comes with it. But then that question of can you use it with patients? I'd agree you can. I have patients where I've said to them, look at what you need. How do we need to help your physical and your mental health? And particularly in mental health, I think there's applications for this. Those patients that struggle with logistical thinking, prioritization, social inclusion, that kind of stuff. And I do think that, things like board games and that kind of stuff can be a route to help them. It's not going to work for everyone. Fine. Everyone needs to find their own message, their own method of trying to find their path kind of thing. But there are definitely groups out there that actually, where board gaming, that social inclusion that comes from it, that computational aspect of process learning and that kind of stuff that is inherent in most board games, even something as simple as Monopoly, roll and move. Well, you need to figure out where you need to move from. Where's the strategy that comes with that? Much better games out there, I'll be honest. I'm not the biggest fan of Monopoly. But, lots of things out there in terms of how you interact with people, that kind of thing. And actually, that social inclusion. And I have actually had patients where I've said to them, try it. Just try it. I'm not, if you want to, go for it, give it a go. And then they've come back to me and they said, you know what? This has really made a difference. I'm now actually leaving my house once a week to go to this event so I can speak, play with other people. And it just brings them that iteration. Or the other one I've had is, parents going off and playing board games with their kids. How much of a learning experience is that? That family time. They're away from the screens. They're away from, the chaos of life, and they're spending time with their kids. Their kids are learning, those basic skills of literacy, numeracy, strategy, rules. We have this increase of, kids going off and, ADHD and all that kind of stuff. We're actually just sometimes showing them in a fun way how to engage with rule-based concepts of a board game and stuff that can learn it. And that's one thing for me, it's a big thing. I almost every week I sit down with my son and we play half-hour board games. He picks the ones he wants to play. As he gets older, I pick more complex ones for him to have a little look at. And he absolutely loves it. Every week he's like, when can we play? And okay, not right now because I'm just having breakfast, but 20 minutes or so, let's go for it. And his skills are learning, his social skills are improving. We had a community event where he was actually teaching all of his friends how to play the games. Wow. And that was amazing. And that's the inclusion, that's the social aspects of it. And I definitely think that's applicable to health. I wish I had studies and journals that could help back me up on that. I probably should spend some time trying to do them, but you know what? That's my view at the moment. Happy to be told otherwise.
Wonderful. It's been absolutely amazing. I was going to call you Gandalf for a second.
That's fair enough.
It's been absolutely amazing. How can people get hold of you? What's the best way?
So various different ways. I guess the best way, I'm on social media, Twitter at Dr. Gandalf 52. I'm not 52 years old, just out of interest. Or for the more tech side of things at eGPlearning. And there's the website with that as well, eGPlearning.co.uk.
Thank you so much.
No, well, thank you for having me. It's been great speaking to you.
Thanks for listening to this installment of the Surgical Spirit podcast. For all the latest in the world of surgical spirit, don't forget to follow on Twitter at The Third Eye Doc and catch me on Facebook at the page The Third Eye Doctor. You can visit the website at www.thethirdeeyedoctor.co.uk for more information on the work that I do. And please send us feedback and questions and suggestions for the podcast. It's always a pleasure to hear from you. I've been Dr. Haidar Al-Hakim, and I'll see you next time.